We just released a really important study on Alzheimer's caregivers. And this is very key to understanding women in America, because it's women who are caring for Alzheimer's patients for the most part. And these women are, not only do they oftentimes have kids at home that they're caring for as well, but they're also, most of them have paying jobs. So this is a real high stress situation for them as they layer in this new responsibility that hits with a parent or an in-law or an elderly relative succumbing to Alzheimer's, and often sometimes their spouse. So what we have found is that there are some dangers here for the caregiver, and that's that they are suffering from a lot of stress. We find that they are relatively sleep deprived, they're not necessarily eating well or exercising, and they're oftentimes missing their doctor's appointments. So they're just not taking care of their health, and they have a very high tendency also to feel feelings of depression. I think we can all understand that, but to really see the numbers is dramatic. We also found that we wanted to find out whether women were really interested in finding out if they had Alzheimer's. Would they want to know early detection or not? This has been a common topic of conversation recently in the press. And what we found out was that the people who were closest to the Alzheimer's situation, which is the caregivers, would, in a great majority, 84%, would like to know early on if they have Alzheimer's disease. When we asked them why they'd like to know, it was because they're suffering themselves as caregivers, trying to understand the wishes and needs of their Alzheimer's charge. So they would like to know early in the diagnosis so that they could express their own needs and their concerns and their wishes to those who will be taking care of them. This important study was funded by GE and is available on workingmother.com.